Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thanks for joining us for another segment. 1 in 5 people suffer from some form of depression or anxiety, which has been exacerbated by the pandemic. Now, barriers and limited access to care, coupled with a shortage of mental health physicians, has helped spur tremendous growth in digital therapeutics, which is not only filling the gap, but increasingly proving to be a viable option. Well, joining us here is Dr. Chris Wasden. He's joining us from Happify Health to talk about these trends and also to discuss the launch of Ensemble. Welcome to Health Professional Radio, Dr. Chris Wasden. Thank you so much for taking the time this evening.
Thank you, Neil. Glad to be here.
Well, what is your area of expertise and what is your role at Happify Health?
Yeah, so I've been an innovator in the digital therapeutic space for over a decade. When I was at PwC, I joined them the year the iPhone came out. And at that time, we saw that the iPhone was going to change healthcare. And this was even before people saw the potential of apps. And so I began to become a thought leader, an author, and speaker on the role that digital therapy was going to play in transforming healthcare and delivering care to patients. And for about 7 years, I was the global healthcare innovation leader at PwC and worked with pharma companies, telcos, other technology companies, health systems around the world to help them become more innovative in the application of digital. I then spent 5 years at the University of Utah, where I ran a digital therapeutic incubator there. That was a partnership with the business school, the medical school, and the video game development school. And then about 3 years ago, after 2 years of consulting with Happify, I joined Happify to start and run their pharmaceutical business. And in this business that I lead, we partner with large global pharmaceutical companies to make digital therapeutic products that support patients on their drug therapies. And then we also make our own digital therapies that we provide to patients. On Ensemble is our first prescription digital therapy that we now offer to patients through physicians.
Is mental health lend itself more to digital therapeutics than other aspects of healthcare?
Yeah, so if we look at healthcare in general, over half of all healthcare costs are associated with poor behaviors. So to the extent that you can change people's minds and then change their behaviors and get them to have more healthy behaviors, that entire area of focus is gained for digital therapeutics, right? So if I can use digital therapeutics to get you to exercise more, change your diet, sleep better, be more active, those are all things that will improve your health and well-being as a patient. I can then extend that into things such as monitoring your blood pressure and monitoring your weight and monitoring your glucose levels, and then providing you nudges to support the behaviors that would make those numbers better, right? So those are all things that are not mental health that I can do with digital therapeutics. And then when you look at mental health itself, there's two issues to keep in mind. One is that mental health is comorbid with all these other chronic conditions. So half of all MS patients have mental health disorders. Almost that many of patients with hypertension and diabetes have mental health disorders. And when you look at reasons why people don't have better behaviors and better diets and better activities and more adherence to the drugs and whatnot with other diseases, it's because of mental health. It's the barrier. If you're depressed, you're not going to take your drugs. If you're anxious, you're not going to take your drugs. So that's an entire area of support where you support the comorbid mental health disorder with the underlying physical disorder. And then you have, obviously, the pure mental health disorder that's not comorbid with anything else that still needs to be treated. And again, just as with these other ones, it's about changing the mind, changing the behavior. With digital therapeutics that are mental health oriented, we're helping people better control and manage their thoughts and resulting their actions so that it decreases stress, anxiety, and depression.
Now, that would seem to be true with some of these mental health conditions, whether or not the pandemic happened. Has the pandemic offered more of an opportunity to introduce digital therapy, or has the exacerbation of some of these conditions made it more of a challenge?
Yeah. So what's happened is the pandemic has taken things that were already bad in society and made them worse. And I'll go through a few things that went from bad to worse. Okay. So part of what drives poor mental health has to do with social isolation, right? So if you feel lonely, if you feel neglected, if you feel abused in some way, that people are not giving you attention and the focus, you're going to feel bad. You're going to feel depressed. You're going to feel anxious. And so with the isolation that we've experienced, you just have significantly greater levels of loneliness. Also, and some people are surprised by this, but they shouldn't be, increased use of social media actually creates greater loneliness and self-isolation. We think of these as social apps, right? It's called social media after all. But what happens is when you focus on this social media by yourself, which most of us do, right? We're not doing this as a group activity. You actually tend to feel worse about yourself, and you feel more isolated. And so there was a recent article in the Wall Street Journal that talked about how 1 in 3 teenage girls feels mentally worse by using Instagram than not. And so you've got that exploded, right? All the digital activity exploded with the pandemic. And with that explosion, you had the explosion of social isolation as well. In addition to that, you have other things that are driving mental health behaviors, and that is, people didn't spend as much time outside in nature. People initially weren't spending as much time doing other physical activities. Now, some of that got corrected by people buying all their Pelotons and things like that to do more of this in their home. But initially, they couldn't go to the gym, and that was their outlet for physical activity. And so they had to bring the gym into their house, and that took some time to do that. But even when you bring that into your house, it's still not the same social activity that it was when it was in the gym, right, where you saw your friends and you chatted with them. Then you've got these kids that, were forced to do all of their schooling online, and that experience was not as satisfying. And then the people that lost their jobs were most often the younger people. And so you ended up having significant amount of mental health happen because people lost their jobs and they lost income and things like that. So financial issues create strain. Social family relationships got more strained because you have 4 people in the home now working from home that weren't there before. And now they're struggling for bandwidth in the home, and they're conflicted with each other, and which parent's going to take care of the kids' school assignments that are all being done online now. Yeah. But your job, are you going to take time out of your busy schedule to go tutor your kids because the teacher's not doing it anymore? So all of this has just created such stress and anxiety and related depression. And part of the depression is because people think that they're kind of through the worst of it, and then another variant happens, right? Yeah. And then everything is locked down because it's never going to end.
You mentioned the prescription digital therapy solution called Ensemble. Talk about this solution, if you would.
So what we do is we look at what are the best therapies ever invented by human beings that are delivered by human beings, this cognitive behavior therapy, mindfulness, things like that. And then how can we replicate those in a digital form that can be on your phone or on the computer so that you can get the same quality, or even in many ways better quality experience of these therapies that you could get with a person in an office. And we now make them fun, short, easy, difficult enough that you have to be stretched and pushed to do the activities that will make you feel better. And what we're doing is we're helping you control your thoughts, eliminate negative emotions, focus on positive emotions, connect with other people. There's 5 different elements of positive psychology that we reinforce with all of our therapies. And that is helping you have meaning in your life, helping you have positive emotions, helping you connect socially with other people, helping you see progress and improvement in what you're doing, helping you get into a state of flow where you are lost in doing other things that help you clear your mind and control your thoughts.
Well, give our listeners a website where we can go and learn more about what's going on there at Happify Health.
Yeah, so you can just type in Happify Health into your Google or your other search bar, and it'll come up, and you can learn more about Happify Health there. And then if you want to know specifically about Ensemble, which is our digital therapy to treat major depressive disorder and generalized anxiety disorder, you can go to getensemble.com.
Well, Chris, I appreciate you joining us here on Health Professional Radio. Thank you so much for your time.
Enjoyed being here. Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Chris Wasden. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.